Hey there, and welcome to This Explainer. Today, we're going to unpack a true biomechanical marvel of the human body, your shoulder. Honestly, if you've ever thrown a baseball, swam a lap in a pool, or just reached up to grab a coffee mug off a high shelf, you've relied on an absolutely beautifully engineered piece of machinery. But today, we aren't just looking at the broad strokes. We're zooming way in to demystify the incredible system that holds the whole thing together. I'm talking about the rotator cuff.
To kick things off, I want you to think about something kind of paradoxical. Why is the shoulder the most commonly dislocated joint in the entire human body? It's pretty wild when you think about it. The exact same thing that makes our shoulder so incredibly useful is literally what makes it so vulnerable. Let's dive into the mechanical stakes of this design. Here's our quick game plan for today. We'll cover 1. The shoulder's grand compromise. 2. We'll meet the sits muscles. 3. The mechanics of abduction. 4. The supraspinatus as the crucial starter. And finally, 5. Tears, pain, and biomechanics.
All right, starting with Section 1, the shoulder's grand compromise between mobility and stability.
So, we've got a profound anatomical mismatch here. On one side, you have the head of the humerus. That's your upper arm bone. It's smooth, it's rounded, it's pretty large, and it forms less than half of a sphere. Then, on the other side, you have the glenoid cavity of the shoulder blade, which is much smaller and way shallower. Think of it like trying to balance a golf ball on a flat wooden tee, rather than resting it deep inside a secure cup. Basically, human evolution sacrificed shoulder stability to give us extreme mobility. We went from walking on all fours to needing a freely mobile arm, so we could place our hands literally anywhere in space. But, that freedom comes at a cost, creating an inherent structural vulnerability. Thanks, evolution.
Moving right along to Section 2. Let's meet the sits muscles, which make up our stabilization system. If you look at the back of the shoulder, notice how these muscles literally wrap right around the joint. You can see the supraspinatus sitting right on top, with the infraspinatus and teres minor wrapping around the back. Together with a fourth muscle on the front, their main job is to actively grasp that large head of the humerus and pull it tight against that shallow little cavity. They form a literal rotator cuff around the bone to solve our golf ball on a tee problem. Now, in the medical world, there's a highly effective, totally brilliant mnemonic to help you lock these four muscles into your memory permanently. It's just SITS. S for supraspinatus, I for infraspinatus, T for teres minor, and S for subscapularis. Whenever you hear the phrase rotator cuff, these are the four distinct muscles pulling the strings behind the scenes. And each of these four muscles has a beautifully specialized role. Notice how the subscapularis on the front handles medial rotation. That's turning your arm inward. The infraspinatus and teres minor handle lateral rotation, turning it outward. But I really want you to pay close attention to that top row, the supraspinatus. Its primary action is initiating abduction. That just means lifting the arm away from the body. But it only does it for the very first 15 degrees. We are going to come back to why that tiny 15-degree window is absolutely crucial. Let's move to Section 3, the mechanics of abduction, looking at this as a chronological movement. Lifting your arm straight up to point at the ceiling, it feels like one smooth, easy motion, right? Well, mechanically, it's actually a super complex 180-degree journey broken down into four distinct phases. Phase 1, from 0 to 15 degrees, that supraspinatus fires up to initiate the lift. Phase 2, from 15 up to 90 degrees, the big powerful deltoid muscle takes over the heavy lifting. Now Phase 3 is where it gets fascinating. From 90 to 120 degrees, your arm actually has to laterally rotate. Why? Well, because the bone of your arm will literally crash into the acromion bone right above it if it doesn't twist out of the way. It's pretty amazing. And finally, Phase 4. To get your arm from 120 degrees all the way up to 180, your actual shoulder blade, the scapula, has to rotate forward on your chest wall. It is literally a mechanical relay race. And this brilliantly illustrates a concept called the scapulohumeral rhythm. Basically, the shoulder and the shoulder blade are fundamentally locked into this mechanical dance. Motion X-ray studies have proven this beyond a doubt. For every 15 degrees you lift your arm bone moves 10 degrees and your shoulder blade rotates 5 degrees. It is a perfect 2-to-1 ratio. If an injury messes with this rhythm, your entire shoulder movement is severely compromised.
Okay, on to Section 4, supraspinatus, our crucial starter.
Here's the crazy part. Without the supraspinatus, those first 15 degrees of lifting your arm are mechanically impossible. Think about the deltoid for a second, that massive muscle on the outside of your shoulder. That's an absolute powerhouse. But because its muscle fibers pull straight up and down when your arm is resting at your side, it mechanically cannot start lifting your arm outward from 0 degrees. It just can't. It literally relies on the supraspinatus to act like a starter motor, pushing the arm out to that 15-degree mark before the deltoid can finally catch it and take over.
Because of this hard mechanical limit, we actually see an amazing adaptation in the clinic. If someone ruptures their supraspinatus tendon, they are completely stuck. They cannot lift their arm from their side. So, what do? Well, they'll lean their whole body toward the injured side. This lets gravity swing the arm out just a few degrees. Or, they'll literally use their good hand to push the injured arm out to that magic 15-degree mark. Only then can the deltoid catch and lift it the rest of the way. It's a really common trick device people figure out purely to bypass a broken starter motor.
Which brings us to our final section, Part 5, Tears, Pain, and Biomechanics. What happens when this system fails?
When we look at what causes rotator cuff disorders, we really just see our anatomy colliding with modern everyday activities. The rotator cuff is, by far, the most common cause of shoulder pain. So who's at risk? Generally, we see standard wear and tear, mostly in guys over 50, but functionally, it's caused by a repetitive use of your arm above horizontal. Think about the intense, repetitive stress of throwing sports or swimming or even just lifting heavy boxes in the garage all weekend. Over time, that supraspinatus tendon gets irritated. That can lead to calcium building up, which then inflames the bursa, which is basically a little fluid-filled cushion resting right above the tendon.
And that inflammation leads to a very specific, totally mechanical symptom called painful arc syndrome. If you have an inflamed bursa, it's going to get caught between your moving tendon and the bony arch right above it. But because of the geometry of the shoulder, this pinching only happens during a very specific window, right between 60 degrees and 120 degrees of lifting your arm. Below 60, you've got clearance. Above 120, the bursa has safely tucked under the bone. But right in that middle arc, it's pinched tight, causing severe pain.
Doctors actually use this exact mechanical sliding quirk to their advantage to diagnose you. It's called Dauburn's sign. If a doctor presses firmly on your shoulder while your arm is just resting at your side, it hurts like crazy, because they're pressing right onto that inflamed, swollen bursa. But if they press on that exact same spot while your arm is raised up high, the pain completely disappears. Why? Because mechanically that inflamed bursa has slid completely under the protective bone, totally out of reach of the doctor's fingers. It's a brilliant little trick that relies purely on understanding the sliding mechanics of the joint.
The human shoulder really is a masterpiece of evolutionary engineering. We traded stability for the incredible freedom to interact with the world around us. It relies on the silent, unified grip of the sits muscles, that perfect 2-to-1 rhythmic dance of the bones, and a tiny little starter motor carrying immense responsibility. So I want to leave you with this final thought. Next time you effortlessly reach above your head to, say, grab a cup from the cabinet, ask yourself, is your perfectly engineered rotator cuff working smoothly behind the scenes? Or are you compensating with a trick device? Thank you so much for exploring the shoulder with me in this explainer. Keep learning and always keep asking how things work.